Hello everyone and welcome back to my channel. My name is Lisi and I talk about nursing, lifestyle, organization, everything that applies to my life on this channel. And in this video, I'm going to be helping you decide on whether it makes more sense for you to pursue your LPN or for you to go ahead and pursue your RN as a prospective and aspiring nurse. Now, I think that the decision should be made primarily based upon your current circumstances. Everyone's life circumstances are different, so I think that it is important to evaluate what your current circumstances are in order to ultimately make that decision. So firstly, I'd like to start by giving a brief rundown on the distinction between LPN and RN. LPN stands for Licensed Practical Nurse, and as a practical nurse, there are certain limitations to what an LPN is permitted to do, but it depends on the setting that you work in and the state that you live in. For example, if an LPN works in a long-term care and rehab setting, there's not much difference between what an LPN and an RN can do. Usually LPNs aren't allowed to initiate IVs and they can't pronounce death. But those are the two major things in that kind of setting that LPNs aren't allowed to do, that an RN would be responsible for. And depending on your state, some LPNs are not even allowed to perform assessments. However, in the real world, LPNs are usually the ones who perform the initial assessments, especially when they receive or when they get a new admission. Basically, they'll give the RN the assessment and the RN will just take that and run with it. So this is something that RNs, trust their LPNs with, because, LPNs are taught to assess in school just like RNs are, and believe it or not, there's a lot of times where RNs are actually learning a lot of clinical-based skills from LPNs, and this especially applies to RNs who, went straight to their RN program and had no previous background experience in nursing and things like that. So usually with LPNs, they're very clinical based. Now with LPNs, they don't really get a lot of managerial positions, but that's not to say that they don't get them. Again, this depends on the kind of setting that they work in. And speaking of settings, LPNs usually don't get hired into hospital settings. They get hired in like clinics, long-term care and rehabs and other settings, but usually hospitals try to stick to hiring RNs. But with COVID coming around, there have been a lot of exceptions being made by hospitals where they have actually needed nurses so desperately that they have actually been taking in LPNs into the hospital setting, and they have been willing to, give them any kind of, teaching or orientation that they need in order to be competent. Now on to RN. RN stands for registered nurse. Being a registered nurse, there are a lot more opportunities in positions of management, and of course, you are allowed or permitted to do more invasive procedures such as initiating an IV line. And as I've stated before, they are also responsible for pronouncing death and performing initial assessments as well on any admissions or patient admissions. They're also hired more into hospitals, as I've stated before. And if you want to think about the business aspect of nursing, RNs do have a slight advantage when it comes to that. For instance, if you are a nurse and you want to open a nurse's aid school, as an LPN nurse, you can actually do that. You can open a school, but you would have to hire an RN to do certain things depending on the state that you live in. But if you are an RN yourself, you wouldn't need to hire an RN. You could just do the teaching yourself and any other requirements on your own that your state, requires. Some states allow LPNs to do more than other states, but you would have to look into what your state requirements are. So now that I've gotten that out the way, let's move on to some of the things that you may want to consider or ask yourself in order to sort out this dilemma of choosing between whether you should pursue the LPN or RN. Number 1, do you have children? I know that speaking for myself, being a parent, I wanted to obtain a career as soon as possible, especially considering my circumstances. My support system was limited, and I wanted to be able to provide a better quality of life, not just for myself, but for my child as soon as possible. So if you have children and you want to expedite the process and getting your foot into the door as a nurse, I would suggest leaning more towards LPN. Given the LPN program duration is shorter, and you can certainly make a pretty decent living starting off your career as a nurse being an LPN. And speaking of support systems, that brings me to my next consideration. Number 2, what does your support system look like? Can you realistically and honestly say that you have reliable, and this is key, long-term support? If your support system is not securely intact, or you cannot honestly say that or confidently say that you have a reliable support system, then it may be best to consider leaning more toward pursuing your LPN. LPN programs are not only shorter in duration, but they are also a little more flexible as far as scheduling goes. There are a lot of more options as far as daytime programs and evening programs, as well as part-time as opposed to full-time. And this is not to say that there aren't any RN programs out there that offer these options, but you don't find them as much as you would with an LPN program. And if it just so happens to be that your support system is not reliable, you may want to consider a program that is a lot more flexible, and not just flexible, but that you can pretty much get in and out of as soon as possible, so that you're not putting yourself through the stress of trying to find daycare or people to rely on for a longer period of time. You do have a reliable and trustworthy support system, and you are a parent, then if you hoped to ultimately become an RN, I suggest just going straight for your RN. Now, if you do not have kids and you don't have that level of responsibility or obligation in your life, then this evidently won't apply to you. And so you shouldn't have a problem just sticking it out for the long haul and pursuing your RN if that's something that, is your ultimate goal. However, in that case, you just have to be real with yourself and evaluating whether making a commitment to sticking it out in school for the long haul, you have to be realistic and ask yourself if this is something that you can do. Now, number 3, am I in a situation that I am trying to get out of as soon as possible? This brings me back to taking into consideration whether you are a parent. This can also apply to, someone who just is living an unstable circumstance and wants to quickly and significantly increase their quality of life as soon as possible because they are going through certain struggles. If that's the case for you, then I'll suggest leaning more toward, pursuing your LPN, because you will be able to complete that program a lot sooner and be on your way toward increasing your quality of life. Now, keep in mind that once you do obtain your LPN, you are starting a career that has room for more growth and opportunities to advance in this particular field. So becoming an LPN can simply be a stepping stone to becoming an advanced nurse down the line, if that is something you are wanting to do. Number 4, how much of a commitment am I willing or able to make? Now, this ties in with what I've mentioned before, but as I've stated, the LPN programs are shorter in duration as opposed to the RN programs. So there are RN programs for an associate degree at a community college, and that can take up to 2 years upon completion of prerequisites. Now, let me emphasize, that's upon completion of your prerequisites. Prerequisite classes in order to get into the 2-year RN program can usually take, on average, about a year and a half to complete. So either way, you're still going to be in school for over 2 years if you hope to pursue your RN at a community college. That being said, you need to ask yourself if time-wise, RN is not only doable, but if it's something that you can honestly see yourself committing to. Now, number 5, am I able to go without work or bring down my work hours to part-time for as long as I am in school? Now, this doesn't apply to every single person as circumstances vary for everyone. But if you are a parent, and all of these things are, difficult for you as far as like time goes, you really have to take into consideration how much time and energy you will need to put into a nursing program. I'm going to be posting a video about how difficult nursing school is and basically what it's like to be in nursing school. But to keep things simple, for the sake of this video, nursing school is no joke. Like, it's extremely difficult. It's very time consuming. It's energy draining. It's so much work, and it's just very consuming. Now, if you already struggle with having time and energy with your current circumstances, especially if you work and, have all of these obligations, then this is something that you have to realistically evaluate. If you are not in a situation where you're living at home with parents, if you don't have a support system, don't have anyone you can stay with or anything like that while you go to school, then you will likely have to take out the extra loans to help you with that financially. But you have to ask yourself if this is something you're willing to do. Number 6, am I able to manage or even accept almost no time, having no time for myself or for my family? Now, whether LPN or RN that you decide to pursue, either program is very time consuming and requires a lot of your focus and hard work, especially if you are doing full-time and if you are if you have other significant responsibilities and obligations on top of you taking on your nursing degree. You have to make sure that you're giving yourself grace. You may not be able to be on top of keeping up with the house as much, spending time with your family as much and your friends, or being able to, be there for your kids as much. You might miss out on things, but, there are a lot of sacrifices that go into pursuing your nursing degree. And you have to ask yourself if this is something that you're willing to fall short on for a while you do your best to, pursue this nursing career. Sometimes it helps to have an extra set of hands or people that you can count on to ask for help. If you have family or friends, or if you even have the budget to seek help from someone else or to pay someone to come and help you with things around the house, chores, or to even purchase if you have the budget to purchase already made or prepped meals for the week, then this is something that you may have to do on occasion in order to make sure that you're staying on top of things and keeping up with your responsibilities outside of this whole nursing pursuit. And now, not everyone has that luxury. So if that happens to be you, then you would have to start preparing yourself mentally to be graceful with yourself. And you have to try not to be so hard on yourself when you can't do it all. Because we all know that nursing school will kick your butt. Now, I don't want to discourage anyone and make anyone feel like it's something that is almost nearly impossible to manage. But there are certainly a lot of things that would have to fall by the wayside if you're someone who doesn't have the extra time, or if you're someone who has a lot of responsibilities and you're someone who has a lot of things going on in your life. So in conclusion, if you're someone who has a significant amount of responsibilities, in my opinion, it is worth considering and leaning toward obtaining your LPN as a stepping stone to help develop a solid foundation and circumstance that will allow you to then transition into becoming an RN if that is of interest to you, if that's something you ultimately hope to do. But as I've stated before, circumstances vary for everyone, and only you can decide and make that decision for yourself. Just make sure that you're really thinking things through. My top suggestion would be to write everything down on paper. Even if you're someone who likes to, just think things through and keep them in your head and evaluate things in your mind, there's something about just putting everything on paper that just makes everything, a lot easier to just really evaluate. Write down the pros and the cons based on your individual circumstance and determine whether it's in your best interest to go the fast track and pursue the LPN first, or just stick it out and go straight for your RN. Now that's pretty much it. That's all I have for you guys. Thank you guys so much for watching. Be sure to visit my website at www.LisiFutureCRNA.com or follow me on Instagram, on social media at LisiFutureCRNA. And that's pretty much it. That's all I've got for you guys. So I will see you guys in my next video. Take care. Bye now.